Many ventilator problems and corrective actions we've already covered, and a more comprehensive review is offered in the operators and service manuals. But there are a few general principles that can simplify life pulse troubleshooting. Most of the necessary troubleshooting will be in response to alarms. It is recommended that when a patient is on the life pulse, you first pay particular attention to the ventilator alarms. And second, make sure that the alarm volume is loud enough to present a sense of urgency when it sounds. If it's turned down too low, you may not even hear it. You cannot turn the alarm volume all the way off. You can, however, turn it down to a level that I think might be a little bit too low in a busy newborn intensive care unit. There are at least 5 basic troubleshooting principles that, if you follow them, will make working with patients on the life pulse a whole lot easier. First, look at the patient. Whenever an alarm occurs, look at the patient first. How's the chest rise? Is it adequate? How's the patient's color? How's his physiologic monitoring, the oximeter, a transcutaneous CO2 monitor if you have it, the heart monitor? Is there an obvious disconnection in a tube near the patient? Maybe the servo pressure is locked at or near its operating level. With most life pulse alarms, the servo pressure will lock and the patient will continue to receive a constant level of ventilation. The cause of the alarm may be determined without increasing conventional ventilator support at all, or providing manual ventilation. But some alarm conditions may require the conventional ventilator settings to be increased a little bit to provide ventilation while an alarm condition is corrected, or the patient may need to be handbagged in worst case. Second, use common sense. There's really no substitute for a skilled and alert clinician at the bedside who takes a logical approach to alarm interpretation. The life pulse makes rhythmic sounds. You're going to become very familiar with them. Learn to recognize when the sounds have changed. The displayed and monitored values should remain at constant, consistent levels. Watch for changes in these levels and then learn to understand what the changes mean and how you should respond to them. For example, the servo pressure value reflects the gas flow and pressure required by the life pulse to produce the now settings that you've dialed in for a patient. If the servo pressure changes, either suddenly or gradually, it can mean many things. Maybe the lung compliance is changing. It's possible that you have a pneumothorax or tension on a pneumo. Maybe a right main stem intubation has occurred. Maybe the patient just needs suctioning. There could be a leak in tubing somewhere. Not all alarms require emergency corrective actions. Use common sense. If the life pulse alarms say one thing and your clinical observation says another, react accordingly. For example, if the humidifier displays a temp low alarm and the circuit and cartridge feels hot to the touch, place the humidifier in the wait mode. Troubleshoot the humidifier and cartridge and then call the Bonnell hotline if necessary to determine if the humidifier, cartridge, and circuit need to be replaced. Third, know the life pulse. Interpreting alarms is difficult, if not impossible, without a good working knowledge of the ventilator, how the feedback control mechanisms function, and really what the various alarms mean. What conditions can cause an alarm? Be aware of that. How does the life pulse respond to an alarm? How should you respond to an alarm? These are all very important concepts. Review this video and study the operator's manual and the in-service manual. Become very familiar with the ventilator and all the resources that are available to you that might help troubleshooting. Fourth, common things happen commonly. Common things are the most likely cause of the majority of the alarms. Common things happen commonly. Most alarms occur due to kinked, disconnected, or obstructed tubes. Knowing this will really help you quite a bit in troubleshooting. The first thing you're going to look at are tubes. It could be the pressure monitoring tube, the jet tube, the purge tube, the T-tube, the conventional ventilator circuitry. Knowing this will really simplify troubleshooting. The solution to these alarms are equally as common. Unkink the tube. Reconnect the tube. Clear the obstructed tube. Again, if the servo pressure has locked at or near its operating level, the tubing problem can be corrected without manual ventilation or changing the conventional ventilator settings. Fifth, use available resources. Bunnell Incorporated offers an operator's manual, an in-service manual, periodic newsletters, research articles. We have a tremendous website full of information. And, of course, we have the 24-hour hotline, which is 800-800-4358. When using the hotline, make sure to gather as much information about the alarm condition as possible. The more facts you have about a situation, the better we'll be able to assist you when you call the hotline. If an alarm condition cannot be corrected easily, perform an operational test. If you've done the self-test, the next step is to do the operational test. This step can help isolate the source of the problem. If the life pulse passes the operational test on a test lung, the cause of the alarm has to be in the ET tube, the conventional ventilator, or the patient. Remember to call as soon as possible after determining that the alarm condition cannot be corrected. Again, most problems are very simple, and even though they may look complicated, just give us a call and we'll be able to help you. Do not hesitate to call if you have any questions or concerns. As we tell people everywhere, it is much better to call and have a good experience than not call and have a bad experience.